Vitamin A, despite its critical role in maintaining many aspects of health, can pose significant risks when combined with certain medications. These interactions are not merely theoretical concerns, they have real-world implications that can affect treatment outcomes and patient safety. The fat-soluble nature of vitamin A means it accumulates in the body, and when combined with certain drugs, it can amplify or alter effects in ways that may be harmful. This complexity underscores the importance of understanding how vitamin A interacts with various medications, particularly for those undergoing long-term treatment or managing chronic health conditions. One of the most notable interactions involves retinoid medications, which are synthetic derivatives of vitamin A commonly prescribed to treat acne, psoriasis, and other skin conditions. These drugs, including isotretinoin and acitretin, work by influencing cell growth and differentiation in ways similar to vitamin A. When vitamin A supplements are taken alongside retinoid drugs, the combined levels of vitamin A compounds in the body can rise to toxic levels, dramatically increasing the risk of side effects such as headaches, dizziness, nausea, skin irritation, and more severe complications like liver damage and elevated intracranial pressure. This synergy can cause the toxic symptoms of hypervitaminosis A to appear even at doses that would normally be considered safe. Patients using retinoid medications must be especially cautious about additional vitamin A intake and should only use supplements under strict medical supervision. Blood thinners, such as warfarin, represent another category of medications that can be adversely affected by vitamin A. Warfarin works by inhibiting the synthesis of vitamin K-dependent clotting factors to prevent blood clots. Vitamin A, particularly at high doses, can influence blood clotting mechanisms and liver function, potentially interfering with warfarin's effectiveness. This interference can increase the risk of either excessive bleeding or unwanted clotting, both of which can have serious or even life-threatening consequences. Because of this delicate balance, patients on anticoagulant therapy need to maintain consistent vitamin intake and should consult their healthcare provider before making any changes to their vitamin A consumption. Unsupervised supplementation may disrupt their treatment regimen and compromise safety. Liver medications also present a critical area where vitamin A intake must be monitored closely. Since the liver metabolizes both vitamin A and many pharmaceutical drugs, excessive vitamin A can exacerbate liver strain or toxicity, especially in patients with pre-existing liver conditions or those taking hepatotoxic medications. Drugs such as methotrexate, used in cancer and autoimmune diseases, or certain anticonvulsants, may compound the liver's workload when combined with high vitamin A levels. This can lead to worsened liver function, elevated liver enzymes, and increased risk of liver damage. Individuals on these medications should avoid self-medicating with vitamin A supplements and instead rely on professional guidance to manage their nutrient and drug intake safely. Moreover, some medications can alter the absorption or metabolism of vitamin A itself, creating a two-way interaction that complicates management further. For example, orlistat, a weight loss drug that inhibits fat absorption, can reduce the uptake of fat-soluble vitamins like vitamin A, potentially leading to deficiency if not carefully monitored. On the other hand, corticosteroids, widely used to suppress inflammation and immune responses, can affect vitamin A metabolism, sometimes necessitating adjustments in vitamin intake to avoid imbalance. The danger of these interactions is compounded by the common practice of self-prescribing dietary supplements, often without awareness of the potential risks. Many people assume that taking vitamin A supplements will only enhance their health or compensate for dietary gaps, not realizing the possible adverse effects when combined with prescription medications. This lack of awareness can lead to serious complications, including hospitalization for toxicity symptoms or disrupted treatment efficacy. It is crucial for healthcare providers to inquire about supplement use during consultations and for patients to disclose all vitamins and supplements they take. Additionally, the elderly and individuals with chronic illnesses are particularly vulnerable to these interactions, as they are more likely to be on multiple medications simultaneously and have altered metabolism that increases the risk of adverse effects. Polypharmacy, the use of multiple drugs, further increases the complexity of managing vitamin A intake safely, requiring careful coordination and monitoring by healthcare professionals. In conclusion, The interaction between vitamin A and certain medications such as retinoid drugs, blood thinners, and liver-related treatments presents a serious concern that must not be overlooked. These interactions can lead to heightened toxicity, compromised drug effectiveness, and significant health risks including liver damage, bleeding complications, and neurological symptoms. For anyone undergoing long-term medical treatment or taking prescription medications, consulting a healthcare provider before beginning vitamin A supplementation is essential. This precaution helps ensure that vitamin A's benefits can be safely harnessed without jeopardizing the efficacy of medications or overall health. Ultimately, managing vitamin A intake with professional guidance is a critical step in preventing harmful drug-nutrient interactions and promoting safe, balanced health management.